Well, good afternoon, everyone. Earlier today, as many of you know, after a full, open, and spirited public discussion that began last May, our Board of Health passed our administration's proposal to limit the portion size of sugary drinks. This has nothing to do with banning your ability to buy as many sugary drinks as you want, simply the size of the cup that can be used. It cannot be greater than 16 ounces under this regulation. This is the single biggest step any city, I think, has ever taken to curb obesity, but certainly not the last step that lots of cities are going to take, and we believe that it will help save lives. Beginning March 12th, sugary beverages will no longer be sold by food establishments in portions greater than 16 ounces. Fruit or vegetable juice with no added sugar or beverages that contain more than 50% milk are not impacted by this rule. The new regulation applies to sugary drinks sold at restaurants, food carts, delis, movie theater concessions, stadiums, and arenas. And the 6-month window will give businesses time to adjust their menu boards, container size, and make any other necessary changes to ensure that they are in compliance so that it will not impact their ability to continue with their businesses. They have plenty of time to make the adjustments. Now, one of those businesses, Forest City Ratner, has stepped forward and decided that when the Barclays Center opens later this month, and I assume you all saw the pictures of the great arena that they have built in the paper today, its concessions will immediately adhere to the new regulation rather than waiting until next March. Thank you. And I would expect many other restaurants to do and places of business to do the same thing. We are glad to be joined today by the chairman and CEO of Forest City Ratner, Bruce Ratner. Bruce, as many of you know, has always been ahead of the game when few people believed it was possible to bring professional basketball back to Brooklyn. Bruce Ratner believed. And now, with the Barclays Center about to open, they're pulling out all of the stops to make sure that they stay ahead of the game. Bruce and the Nets want to do what's right for their customers, many of whom will be children, and by doing that, they are helping our city look forward to a brighter future. I'm excited to say I just got my Nets season tickets to go along with my Knicks season tickets. I've always loved the Knicks, or at least since I came to New York, I've always loved the Knicks and gave up on my hometown Celtics, and now I love the Nets as well. When they play each other, it is going to be a great event for our city, and I will be cheering for a double overtime, buzzer-beating thriller without changing my facial expression, no matter who scores a basket at either end, so you cannot get a picture of me favoring one team or the other. All kidding aside, Bruce, as many of you know, is a former Commissioner of Consumer Affairs under Mayor Koch, and he's never lost his sense of civic responsibility. And I just wanted to thank him for standing up on this critically important issue. He does understand how important this is to the health of New Yorkers because, as the data shows, and as a growing number of supporters have been saying for months, sugary drink consumption is a key driver of the obesity epidemic in our city and across the United States, and reducing the amount of sugary drinks that we consume is the simplest diet change that we can make to help lose weight or to maintain a healthy weight. If New Yorkers reduce portion size to 16 ounces from 20 ounces for just one sugary drink every 2 weeks, that alone will collectively save something about 2.3 million pounds over a year in New York City. Our administration takes the responsibility to support New Yorkers in improving their health and the health of their families very seriously. That's what this reform is all about. It builds on the work that we've already done to give New Yorkers more information, like calorie counts in chain restaurants, so that they can make better choices about the food they and their families consume. And it is in line with earlier reforms, like our ban on trans fat. A study released this summer shows that New Yorkers on average consume nearly 2.5 fewer grams of trans fat per meal after we implemented the ban. And the study went on to say that not only were restaurants serving healthier foods, consumers were making healthier choices as well. When we implemented calorie counts in our reform to eliminate trans fats in restaurants, if you remember, there were more than a few skeptics, but today both reforms are recognized as national models. In fact, the federal health care reform law requires calorie counts nationwide by 2013. And that came about because we had done it first. And just yesterday, McDonald's, the great hamburger company, announced that it will begin posting calorie counts on all of its menus next week, well ahead of schedule. And I think it's a testament to how fast change can happen. Just a few years ago, McDonald's went from fighting our calorie count here in New York, even joining in a lawsuit to stop it a few years ago, to embracing it for all of their restaurants across the nation. And the fact that consumers like it gives them a leg up on the competition. So I think it's a very smart move. About an hour ago, I talked to Don Thompson, the president and CEO of McDonald's. He pointed out to me that they've had 3 years of experience now with calorie counts in New York City, and it has certainly not hurt their business one bit. They have instituted calorie counts in England about 6 months ago, and so far they have not noticed any diminution in their business, and they do not expect this to hurt their business at all. In fact, they think that it will give them a leg up, showing their customers that they care about their customers' health while doing what's right for their stockholders at the same time. We've taken bold action in New York City because obesity is a national epidemic that's getting worse, and we're not just going to wring our hands about it. The fact is nearly 60% of adult New Yorkers are overweight or obese, and each faces a greater risk of developing a host of diseases, including type 2 diabetes and cancer and hypertension and heart disease, kidney disease, liver disease, joint problems, and blindness. And of course, obesity doesn't just affect adults. Among New York City kids, nearly 40% are overweight or obese. Each faces a higher risk of developing all the diseases I just mentioned, and tragically, each also faces a greater risk of early death. In fact, obesity is the second leading cause, just after smoking, of preventable death in our city, and nearly 6,000 New Yorkers die each year because they are overweight or obese. For decades, if you remember, smoking was seen as an intractable problem and one too big for local government to address. But over the past decade, smoking among adult New Yorkers has dropped 35%, resulting in more than 450,000 fewer smokers in our city. And estimates tell us that that means 50,000 fewer smoker-related deaths by the year 2052. Our success in cutting smoking deaths to record lows is one of the key reasons that New Yorkers are living 3 years longer than we did back in the year 2000, and compared to about 1.5 years longer in the rest of the country. And it shows that we can tackle the toughest public health problems head on and make a huge difference, but only if we're willing to act boldly and to target the problem comprehensively. And that's what our administration has done with smoking, and it's what we're doing with obesity. In addition to the tragic human toll, obesity is placing a growing burden on public finances. Obesity costs New York City alone over $4 billion in direct medical costs each year. Nationwide, that number is something like $150 billion each year. And we realize that we can't simply treat the effects of obesity. We must help people change their lives before they ever need to enter a hospital. And that's why we brought 10 agencies together to form the Obesity Task Force and launched a citywide effort to expand on our work to tackle this crisis. Led by Deputy Mayor for Health and Human Services Linda Gibbs and Deputy Mayor for Operations Kaz Holloway, the Obesity Task Force has outlined an aggressive strategy for helping more New Yorkers get healthy and stay healthy. And their report, Reversing the Epidemic, includes efforts to help more New Yorkers gain access to healthy food, learn easy ways to eat fewer foods with large amounts of fat and sugar and sodium, and become more physically active. It also details new partnerships between government and the private sector, like Shop Healthy NYC and Shape Up NYC, an effort led by our Department of Parks and Recreation to provide fitness classes at parks located across the city. And our administration will continue working with a range of partners throughout New York to do even more to help New Yorkers win this fight. With that, I would like to welcome Health Commissioner Tom Farley, whose leadership has been instrumental, to say the least, to share a few words. Tom?
First, I want to just take a minute to thank my wonderful staff at the Health Department for developing this proposal that is groundbreaking and I'm convinced will ultimately be effective, and for reviewing the evidence and presenting it so convincingly to the Board of Health. Yes, thank you. I won't mention you by name, but you certainly know who you are. I'm a pediatrician, and I'm proud to say that today New York City's Board of Health took a historic step to address our children's generation's biggest health problem, obesity and the epidemic of diabetes that it's driving. This is not the first time that the Board of Health has intervened to protect New Yorkers against major health threats of the day. In the 1800s, the Board of Health required physicians to report cases of tuberculosis to control tuberculosis. In 1959, the Board of Health banned the use of lead in paint to prevent brain damage from our children. In 2006, the Board of Health banned the use of artificial trans fats in restaurants. All of those actions were controversial at the time, but all of them have been successful, and today nobody questions them. So the Board of Health has again demonstrated today that it's a model for the rest of the nation. Obesity is a problem that is simply too big to walk away from. By limiting portion sizes of the #1 driving force of this epidemic, we're taking a major step towards reversing it. I know many will say that this rule will be impractical to implement, so I want to thank Bruce Ratner for being here today and taking the bold step of implementing it ahead of the requirements for the new in Atlantic Yards and demonstrating that it absolutely can be done. I hope that other owners of restaurants and venues around the city will do the same in advance of these requirements. So thank you very much.
Thank you, Tom. Forest City Ratner is the first business to step up and embrace this new reform, but I will say I expect lots of others. It's going to go into effect in March, but it's a chance right now to move up against your competition and to really do something for your customers, and as a business owner to be able to go home and look yourself in a mirror and say, you know, I did what was right, and it's also going to be good for your business. Bruce has never been shy about taking on a challenge, like bringing professional basketball to Brooklyn, and here he is, my hero.
You're my hero. That's
well, I don't know about that.
That's for sure. Thank you. No, Mr. Mayor, you are my hero. You really are, by doing this today. So in 2 weeks, we open the arena, and I'm proud to announce that we will not be having drinks, sugary drinks, in excess of 16 ounces. And I'm so glad to be part of that initiative. I'm so glad to be the first. This is a very important initiative. I followed the issue from the very first day it came out. And being someone who follows a lot of what this city does and loves this city, I think it's a great initiative. I think it's very important. Obesity has become such an epidemic in the city, particularly with children. This is particularly meaningful for children. And I want to say that it wasn't a difficult decision at all. It was the right decision. It was easy for me to make because it's so important. And it follows so much that this administration has done, whether it be with smoking or trans fats or some of the other major health initiatives. The other thing is the beverage industry is, in fact, recognizing that and has been making efforts to offer a diversity of drink sizes. And we will be having smaller drink sizes, different types of drinks available at the Barclays Center. And we have worked with Coca-Cola to actually do this initiative. They've been cooperative and wonderful about it. And I'm proud to say that they're in agreement about not having sugary drinks in excess of 16 ounces in the Barclays Center. So that's a great thing. It is time really for us to do this kind of initiative. We need to change how we look at obesity. The mayor has really started that. And again, I want to congratulate you, Mr. Mayor, on a wonderful initiative that I support and I'm proud to be part of. Thank you.
Bruce, thank you. I think you do make a good point that it should be noted that the big beverage companies, particularly Coca-Cola and PepsiCo, understand that they have a responsibility, and they are trying to transition their customers to non-sugar drinks. There's Coke Zero, there's Diet Coke, there's Diet Pepsi, and it's in their interest to make that transition, and they are working to try to make their products better for their customers. That's what you have to do in business. You have to keep evolving, and I think they deserve some credit for all of the efforts and the direction that they're going. They haven't gotten where we think they have to be, but this is something that across this country people are starting to look at their health care costs and realize that obesity is one of the major drivers of costs. Taxes are going to go up every place to pay for the effects of obesity. We have to do something, not to mention the human tragedy of kids and adults coming down with diabetes, losing limbs, going blind, and dying earlier. Before we take questions, let me just summarize today's announcement for Spanish-speaking New Yorkers. Hoy la Junta Directiva de Salud vota a favor de nuestras propuestas para limitar las porciones de bebidas azucaradas. Este es un gran paso para combatir la epidemia de la obesidad y creemos que ayudará a salvar vidas. And with that, we'll be happy to take some questions.